Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How long until I lose weight on Wegovy? Wegovy takes time to work, but you may see some weight loss in the first 4 weeks of treatment. After 1 year, adults taking Wegovy lost 15% of their weight, 35 pounds/15.9 kilograms, on average, compared to a 2.5% weight loss, 6 pounds/2.7 kilograms, in those taking an inactive pill. Overall, after 68 weeks, 83% of adults taking Wegovy lost 5% or more of their weight compared to 31% of adults taking a placebo. In adolescents 12 years of age and older, Wegovy led to a 16.1% decrease in body mass index, BMI, at week 68, compared to a 0.6% BMI decrease with placebo. In addition, 77% of patients in the Wegovy group had a BMI reduction of at least 5%. In the placebo group, only 20% of patients had a BMI reduction of at least 5%. Wegovy doses are slowly increased when you first start treatment to help reduce side effects like nausea or diarrhea. It typically takes 17 weeks to reach the full maintenance dose of Wegovy, based on how well you tolerate the medicine. The maintenance dose of Wegovy, semaglutide, is 2.4 mg injected subcutaneously, under the skin, once a week, with or without meals. It comes in a prefilled, single-dose pen. Your healthcare provider will teach you how to give these injections so you can use it at home. Wegovy studies and weight loss. In randomized, placebo-controlled studies conducted by Novo Nordisk, the manufacturer of Wegovy, weight loss was assessed over a 68-week period in 1,961 adults taking either Wegovy or a placebo. Both groups were instructed to also follow a plan of reduced calorie meals and increased physical activity. In these studies, patients were classified as either obese, BMI 30, or with excess weight, BMI 27, with a weight-related medical problem, such as high blood pressure or high cholesterol. The average starting weight for both groups was about 232 pounds, 105.4 kilograms. Both groups were instructed to also follow a plan of reduced calorie meals and increased physical activity. Adults taking Wegovy lost an average of 35 pounds, 15.9 kilograms, or about 15% of their body weight. Those taking placebo lost an average of 6 pounds, 2.7 kilograms, or roughly 2.5% their body weight. How many people lose weight with Wegovy? In the 68-week studies, 83% of adults taking Wegovy lost 5% or more of their weight compared to 31% of people taking a placebo. 66% of adults taking Wegovy lost 10% or more of their weight compared to 12% of people taking a placebo. 48% of adults taking Wegovy lost 15% or more of their weight compared to 5% of people taking a placebo. However, some people dropped out of the research studies. In clinical trials with 2,116 participants, 6.8% of people in the Wegovy group and 3.2% in the placebo group discontinued treatment due to stomach side effects like nausea, vomiting, and diarrhea. Related questions. 6 Wegovy side effects you need to be aware of. How do Ozempic, Mounjaro, Wegovy, Zepbound compare for weight loss? Ozempic versus Wegovy, what's the difference between them? What are the top 5 most common side effects with Wegovy? The top 5 most common side effects are nausea, diarrhea, vomiting, constipation, abdominal, stomach area, pain. Stomach side effects are most common when starting treatment but decrease over time in most people. Headache, fatigue, and hypoglycemia have also been reported. Adolescents treated with Wegovy had greater incidences of gallbladder problems including gallstones, low blood pressure, rash, and itching, when compared to adults treated with Wegovy. Related side effects with Wegovy. In detail, how does Wegovy work? Wegovy, semaglutide, is classified as a glucagon-like peptide 1, GLP-1, receptor agonist. It works by acting like a hormone in your body that signals brain receptors involved in your appetite and food intake. It can reduce your appetite, which may help you eat less and lead to weight loss. It also slows down how quickly the stomach empties, which makes you feel fuller for a longer period of time. Wegovy is used in addition to diet and exercise for long-term weight management. In adults who are either obese, BMI 30 kg/m2, or overweight, BMI 27 kg/m2, with at least one weight-related condition such as high blood pressure, type 2 diabetes, or high cholesterol. In adults, to reduce the risk of cardiovascular death, heart attack and stroke in people with cardiovascular, heart, blood vessel, disease with either obesity or overweight. In adolescents 12 years and older with an initial BMI at or above the 95th percentile for age and sex, based on growth charts. Other prescription drugs that also contain semaglutide are Ozempic, injection, or Rybelsus, oral tablets. These brands are only approved to treat type 2 diabetes, together with diet and exercise. This is not all the information you need to know about Wegovy, semaglutide, for safe and effective use and does not take the place of your doctor's directions. Review the full Wegovy, semaglutide, information and discuss this information and any questions you have with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.